Hi, you guys. It's Diana, and the topic I chose for my signature project is skin to skin contact. And the reason I chose this is because we just did clinicals in OB, and I was able to see this firsthand. And after doing some more research on it, it actually is very important, and it's a critical, I would say it's a critical part of the birthing process. Um, so skin to skin contact right after birth affects postpartum depression and also maternal infant bonding. Postpartum depression affects 1 in 7 mothers and can make bonding and recovery much harder. And us as nurses, we're in the perfect position to help improve these outcomes. And so, pretty much, my project shows whether immediate skin to skin contact can reduce depression symptoms and improve bonding. So the background and rationale behind this, skin to skin contact means the placing the baby directly on the mother's chest right after delivery. And research already shows that this helps stabilize the baby's breathing, temperature, and heart rate. And it also increases the oxytocin, the bonding hormone, which helps mothers feel calm and connected. And after clinical, yeah, I seen that firsthand. And let's see. So the barriers for skin to skin contact include staff shortages, routines in the delivery room, and lack of nurse training. So nurses should be present immediately after birth, and there should be a protocol for this lack of education. So I have a plan. So my implementation for the plan would be to train the staff for a week about skin to skin contact benefits and steps, and to start the new skin to skin contact protocol the following week. All healthy mothers and babies during the 3 month period can participate, and nurses will document when skin to skin contact starts and how long it lasts. And there'll be like weekly um, chart check compliances, I mean. And the barrier, what am I saying? So mothers who had immediate skin-to-skin contact are expected to have lower depression scores, higher bonding scores, and um, that shows a simple, free nurse-led action can improve emotional and physical recovery. And this will improve patient satisfaction, which I'm sure the hospitals always want patient satisfaction, right? So also emotional recovery and nurse patient trust. And so early skin to skin contact is a simple but powerful intervention. It can reduce postpartum depression and strengthen bonding. Nurses are the best team to lead this change. By using evidence-based practice, we can improve postpartum outcomes for mothers and babies. And the research question, does immediate skin-to-skin contact after birth reduce postpartum depression and strengthen bonding compared to delayed or no skin-to-skin contact? And so our SMART objectives would be specific, begin skin-to-skin contact, it's a tongue twister, within 5 minutes after birth. And the way that we can measure this would be increased skin to skin contact rates from 50 to 90 in 3 months, and achievable, provide a 1 week training for labor and delivery nurses. Relevant would be support emotional health and early bonding. And time bound, measure the outcomes at 6 weeks postpartum using the EPDS and MPAS skills. And by using those skills, the EPDS screens for depression and the MPAS measures bonding. So comparing the results before and after the protocol is where we're actually going to see whether this protocol is helping mothers and babies, or if we're staying plateau and it's not really making a difference, or if it's completely not working at all. But based on the previous evidence-based practice, there's a good chance that it's going to be improving everything from the mother to the mother bonding with the baby. And that is my presentation. Thank you so much.